All right, so you've just had a tooth extracted. If that's you, you are in exactly the right place. We're about to walk through everything you need to know to make sure your recovery is as smooth and speedy as possible. So let's get right into it.
So the procedure's done, and now you're in the aftercare phase. It can feel a little uncertain, right? But don't you worry. This guide is designed to give you super clear, actionable steps to make this whole process way more comfortable.
Okay, first things first, we have to talk about the first 24 hours. This is, without a doubt, the most critical window. What you do right now, and maybe more importantly, what you don't do, is going to set the stage for your entire recovery.
The most important player in this whole game is the blood clot. I want you to think of it like your body's own perfect natural bandage. It forms right there in the empty socket, and its whole job is to protect the super sensitive bone and nerves underneath. So your number one goal, bar none, is to protect that clot.
So how do we protect it? Well, you've got to avoid a few things. Basically, any action that creates suction, pressure, or a lot of heat in your mouth is a risk. That means no rinsing or spitting, no smoking or vaping, and please, absolutely no drinking through a straw. That suction can literally pull the clot right out. You also want to steer clear of hot stuff, like soup or coffee, which can dissolve the clot. And definitely skip the gym for now.
Now, you're probably going to see a little bit of bleeding, and that's completely normal, so don't panic. A little bit of oozing or seeing your saliva tinted pink for a few hours is totally fine. The time to get concerned is if you're soaking through a fresh gauze pad every 15 minutes. If that's happening, that's your cue to call the dentist. Okay, congratulations. You've made it through the first 24 hours. The hardest part is over. Now, your aftercare routine starts to shift just a little bit as we build on that healing foundation. After that first day, it's time to start a gentle saltwater rinse. This is great for keeping the area clean and helping it heal. Just mix about half a teaspoon of salt into a glass of lukewarm water. Now here's the crucial part. Do not swish it around aggressively. Just gently tilt your head side to side and let the water flow over the area. And when you're done, lean over the sink and just let the water fall out of your mouth. Remember, do not spit. So just to really hammer this home, wait that full 24 hours, use lukewarm salt water, be super gentle, and just let the water fall out. You're avoiding any kind of pressure. And by the way, you also want to steer clear of harsh stuff like the alcohol you find in a lot of commercial mouthwashes that can really irritate the healing tissue. You know, speaking of taking it easy, this applies to your whole body, not just your mouth. You really should avoid any kind of strenuous exercise or heavy lifting for at least 4 days. Getting your heart rate up also gets your blood pressure up, and that can lead to more bleeding, pain, and swelling right at the extraction site. So just give your body a break. All right, let's talk about the big question on everyone's mind. What can you actually eat? Well, for the next few days, your diet is all about being gentle and kind to that healing socket. I want you to think soft, cool, and easy. Smoothies are fantastic. Just, you guessed it, drink them from a glass, no straws. Lukewarm soups, scrambled eggs, yogurt, applesauce, mashed potatoes. These are all your best friends right now. And hey, this is a perfect excuse to have some ice cream or pudding. And now for what to avoid. For the next few days, anything hard, crunchy, or chewy is just off the menu. So that means no nuts, no chips, no tough breads. You also want to avoid spicy and acidic foods. They can really sting and irritate the wound. And finally, be really careful with small things like seeds or grains because they can get stuck in the socket and cause a whole new set of problems. Look, even when you do everything right, sometimes little complications can pop up. But being able to spot the signs early is your superpower here. So we're going to look at the 2 most common issues you might run into: dry socket and infection. Here's the general rule. Your pain should be gradually getting a little better each day. If you get to day 2 or 3 and your pain suddenly gets worse, that's a red flag. So let's figure out how to tell the difference between the 2 most likely culprits. So how do you tell them apart? A dry socket is what happens when that blood clot, our natural bandage, is lost too early. That exposes the raw bone and nerves, which causes a really sharp throbbing pain a few days after the procedure. An infection, on the other hand, is caused by bacteria. The pain might steadily get worse, but it usually comes with friends, like pus, swelling, or even a fever. To get even more specific, here are the top signs of an infection you need to watch for. Pain that's getting worse instead of better is a big one. Swelling that's actually increasing after the 48-hour mark. Any white or yellow pus coming from the socket, a bad taste or smell that just won't go away, a fever, or swollen glands under your jaw. Those are all clear signs to call your dentist.
And that brings us to our final and maybe the most important section of all, knowing exactly when to stop guessing and just pick up the phone and call your dental professional. And please, don't ever feel like you're being a bother. I promise you, your dental team would much rather you call with a question than have you sitting at home worrying. Think of this as your definitive checklist for when to make that call. Let's run through it one last time. Make the call if you have heavy bleeding you can't get under control. Call if your pain gets worse after day 3 or your painkillers just aren't cutting it. Call if the swelling increases after the second day. And absolutely call if you have any signs of infection, like a fever, pus, or a bad smell. Lastly, if you have any weird numbness or tingling that lingers in your jaw, lip, or chin, that's something they need to know about.
And that's really the bottom line here. If something feels off, or if you're just not sure, don't second-guess yourself. Just call your dentist. Your peace of mind is a huge, huge part of healing well. So take care of yourself, and here's to a speedy recovery.